Good afternoon, good evening, or good morning, depending on when and from where you are joining us. I'm Dr. Phoebe Thorpe, and it's my pleasure to welcome you to CDC Public Health Grand Rounds for February 2019. We have an exciting session, so let's get started. But first, a few housekeeping slides. Public Health Grand Rounds has continuing education available for physicians, nurses, pharmacists, veterinarians, health educators, and others. The course code is PHGR10. Please see our website for more details. Grand Rounds is available on the web and all your favorite social media websites. Please send your questions to grandrounds@cdc.gov, and we'll try to include it in our Q&A today. Want to know more about preventing lead poisoning in children? We have a featured video segment on YouTube and our website called Beyond the Data, which is posted after the session. This month's segment features my interview with Dr. Mona Hanna-Attisha. We have also partnered with the CDC Public Health Library to feature scientific articles about this session. The full listing is available at cdc.gov/science clips. Here is a preview of upcoming Grand Rounds topics. Please join us live or on the web at your convenience. In addition to our outstanding speakers, Dr. Ettinger, Dr. Mona Hanna-Attisha, and Dr. Brycey, I'd like to acknowledge the important contributions of the individuals and groups listed here. Thank you. If you are interested, please join us downstairs at the CDC library. Dr. Mona will be book signing, and there are light refreshments. Thanks to the CDC library and the CDC Young Professional Networks for their support. And now it's my pleasure to introduce the CDC Deputy Director, Dr. Ann Schuchat.
Good afternoon, everyone, and welcome to what I think is a very special Public Health Grand Rounds. No safe blood lead level in children has been identified. Chronic lead poisoning has been recognized for centuries. In the U.S., research in the 1920s and 30s pointed to the danger that lead paint posed for children, but little or no action was taken for decades. And the discovery that lead additives could make gasoline engines stop knocking gave virtually all Americans high blood lead levels in the 50s and 60s. Subsequently, federal policies aimed at reducing lead in the environment led to a 94% drop in the average blood lead level among 1 to 5-year-olds between 1976 and 2014. But millions of American children are still being exposed to lead in their homes and the environment. More than 500,000 children have elevated blood lead levels. Some groups of children are more often exposed to lead. Non-Hispanic Black children and children living under the federal poverty levels are more than twice as likely to have elevated blood lead levels. The Flint water crisis highlighted that the problem of lead exposure is far from over and raised awareness that there are cities across the nation with significant lead hazards. The solutions might be different in every community, whether the issue's the aging water infrastructure, older homes with lead-based paint hazards, the removal of hazardous wastes, or all of these plus more. Although tremendous progress has been made, more can be done. Secondary prevention through blood lead testing and surveillance plays a critical role to ensure that children exposed to lead receive follow-up services to prevent further exposure and mitigate lasting additional effects. Today, we'll learn more about these issues, about preventing childhood lead poisoning, lessons learned from Flint, Michigan, and how each of us can take steps to make a lasting difference for future generations. Thank you.
Thank you, Dr. Schuchat. And now it's my pleasure to introduce Dr. Ettinger.
Thank you.
Thank you. Good afternoon, and thank you for the opportunity to speak with you today. CDC has a longstanding responsibility and commitment to protect children from childhood lead poisoning. The Lead Contamination Control Act of 1988 authorized CDC to initiate program efforts to eliminate childhood lead poisoning as a public health problem in the United States. Through our cooperative agreement program, we currently support 42 states, 5 counties, 5 large cities, and the District of Columbia to develop prevention programs and policies and to conduct blood lead surveillance activities. CDC's Childhood Lead Poisoning Prevention Program is committed to the national Healthy People goals of reducing blood lead levels in children and eliminating differences in risk based on race, ethnicity, and social class. Lead can be found throughout our environment. Lead-based paints were banned for residential use in 1978. However, homes built before that time likely contain some lead-based paint. This can create lead-contaminated paint chips and dust, which can be deposited throughout the interior and exterior of the home. Deposits from years of leaded gasoline use and industrial sources may also contaminate soil. Certain drinking water pipes may contain lead. Lead can be found in some consumer products, such as toys and jewelry, and lead is sometimes found in foods, spices, and cosmetics imported from other countries and traditional home-based remedies. Parents may bring lead into the home from certain jobs or hobbies that involve working with lead-based products. According to a recent health impact assessment from the Pew Charitable Trust and the Robert Wood Johnson Foundation, at least 1,135,000 children ages 1 to 5 years of age have blood lead levels at or above 2 micrograms per deciliter, the threshold used by this group. The American Community Survey estimates that there are approximately 24 million homes and housing units that contain significant lead-based paint hazards, including deteriorated paint and dust. At least 3.6 million of these homes are homes to young children. And additionally, there are at least 6 million lead service lines carrying drinking water to homes in the United States. No safe level of lead in children has been identified, and exposure to lead can seriously harm a child's health and cause well-documented adverse effects, such as damage to the brain and nervous system, slowed growth and development, learning and behavior problems, hearing and speech problems. There's also emerging evidence about the long-term health impacts of exposures to lead across the lifespan. However, the good news is that lead poisoning is 100% preventable. Overall, as you've heard, U.S. population blood lead levels, as evidenced by the National Health and Nutrition Examination Survey, or NHANES data, have declined over time. This is due in large part to successful federal policies aimed at controlling sources of lead in the environment, including removal of lead from gasoline, paint, plumbing fixtures, and many consumer products. On this graph, the red line associated with the axis on the right shows the overall trend in geometric mean blood lead levels in children aged 1 to 5 years, which has declined from 15 micrograms per deciliter in the late 1970s to less than 1 microgram per deciliter in the most recent 4 years of NHANES, representing a 94% decrease over time. Despite the success in reducing children's blood lead levels overall, NHANES data also indicate that disparities in exposure, as measured by blood lead levels, still exist. This graph shows that non-Hispanic Black children are 2 times more likely to have blood lead levels greater than or equal to 2 micrograms per deciliter, which again is the threshold used in the Pew RWJF Health Impact Assessment. Data from NHANES also indicate that children living in older homes built before 1946 and those whose family incomes are at or below the federal poverty level are at highest risk for lead exposure. There are still many locations throughout the U.S. with significant numbers of children with lead exposure. This map shows the estimated distribution of blood lead levels in the U.S., that it varies by geographic location, mainly due to the distribution of lead sources in the environment and other risk factors, such as housing age and poverty. Because lead is local and the distribution of risk factors varies by location, the interventions required to eliminate lead exposure risk will also vary depending on local conditions. And despite the existence of well-known risk factors, many children who are exposed to lead are not being tested. Federal law requires blood lead testing for all children enrolled in Medicaid at 12 and 24 months of age, or for any child between 24 and 72 months of age with no record of a previous blood lead test. This map shows the estimated percent of children with blood lead levels greater than or equal to 10 micrograms per deciliter, the CDC blood lead level of concern at the time, that was missed by states for the period 1999 to 2010. Less than 20% of all young children, regardless of funding sources, are tested by healthcare providers, which identifies only 60% of children with elevated blood lead levels in the U.S. There are regional differences in blood lead testing, with the best testing and reporting rates among children in the Northeast and Midwest, and the worst in the South and the Western U.S. CDC's core programmatic strategies focus on strengthening blood lead testing, reporting, and surveillance by working with state and local partners to identify high-risk populations, ensure effective linkages of lead-exposed children to recommended follow-up services, and promoting targeted population-based interventions to address lead in the environment. Primary prevention, or the removal of lead hazards from the environment before a child is exposed, is the most effective way to ensure children do not experience the harmful long-term effects of lead exposure. However, secondary prevention, including blood lead testing and follow-up, remains an essential safety net for children who may already be exposed to lead. And preventing childhood lead exposure is cost-effective. According to the Pew RWJF Health Impact Assessment, the required federal investment to prevent children born in 2018 from having blood lead levels above zero is $80 billion, and the estimated societal benefits would be $83.9 billion, which represents a 5% return on investment. And if the necessary investment required to remove lead from the environment is less actually than $80 billion, the cost-benefit ratio would be higher. And additionally, permanent removal of lead hazards from the environment would benefit future birth cohorts, and these benefits would be cumulative over successive years. This chart shows that the economic benefits of decreasing lead exposure are greatest for children at the lowest blood lead levels. Preventing childhood lead exposure will require significant policy and regulatory action coordinated across levels of government and public and private investments, but it has the potential to generate substantial economic and public health gains. Thank you for your attention this afternoon. For more information, please see our website with a link to our special supplement to the Journal of Public Health Management and Practice on lead poisoning prevention. And now, it is my pleasure to have the opportunity to introduce our next speaker, Dr. Mona Hanna-Attisha. Dr. Mona, as she is known by her Flint kids, is a board-certified pediatrician, professor, and public health advocate. Among her many well-deserved honors, she was named one of Time Magazine's most influential people in 2016 for her role in exposing the Flint water crisis and her public health advocacy in response to the crisis. We are thrilled to have her here to speak with you today.
Thank you. It is great to be here. Thank you, Adrian. Thank you, Dr. Shuckett. It's great, just great and humbling and an honor to be here. I'm so excited to share the Flint story, but really to share the light that Flint has cast across this nation in regards to our unfinished work regarding lead elimination. And this is work that we must all do to protect the promise of all of our nation's children. And I want to start by introducing you to one kid. This is Lilly. She's one of our beautiful Flint kids. And it wasn't too long ago that she came into clinic for a 6-month checkup. And it is my privilege as a pediatrician to make sure that Lilly is healthy today. But more importantly, my work as a pediatrician is critical to make sure that she has the healthiest and brightest future possible. My work, just like your work, is nestled in prevention and really in the potential of our children. But in Flint For Lilly and for thousands of other kids, there was something happening in our city that really was threatening all of their tomorrows. And we'll get to that. But before we go into kind of what happened in Flint, I want to share with you, and hopefully you all know that Flint was not always synonymous with disaster. Flint was the birthplace of cars, of General Motors. Flint was one of the country's greatest industrial cities, a promised land in the Great Migration North and for immigrants all over the world. And even more than that, Flint was the birthplace of the middle class, thanks to organizing and labor and contracts, which brought prosperity and opportunity in the form of living wages, healthcare, housing, great schools, infrastructure, and even great benefits. And it's hard to believe, but at one point, the people of Flint had the highest per capita income in the country. Not too long ago, the 1970s, the people of Flint had the highest per capita income in the country. And because of that, some of the best public health indices. But what followed in Flint was decades of inequality and injustice, driven by greed and racism and neglect. Plants closed, jobs were lost, poverty and violence became epidemic. And Flint really has been in crisis for decades. And Flint became a place, like so many in our country, where the zip code of birth, even more than your genetic code, is the greatest predictor of where you'll end up. Our kids in Flint, kids like Lilly, will actually, their life expectancy is 15 years less than the life expectancy of a child in an adjacent neighboring zip code. And that's not right. And because of Flint's dire kind of financial state, in 2011, the former governor appointed an emergency manager, usurped democracy overnight to run the city. And the emergency manager's job was austerity, to save money, really no matter what the cost. And they decided that the water that we had been getting from the Great Lakes for half a century was too expensive for this poor, predominantly minority city, and that instead we would start drawing water from the local Flint River until a new pipeline to the Great Lakes was to be built. And it didn't seem right. Do you remember seeing these pictures? This is real. This is from a Flint home. Even when I first saw it, I'm like, this must be photoshopped. Somebody must have put like iced tea through this faucet sink. This can't be right. It was real. And it turned out that the Flint River water wasn't being treated properly. And it was missing an important ingredient called corrosion control. And that made our water about 20 times more corrosive than the water that we were getting from the Great Lakes. And that brown, rusty color was because of iron corrosion. And it was so corrosive that within just a few months of being on this water, General Motors, which was born in Flint and still has plants in Flint, stopped using this water because it was corroding their engine parts. And they got a bypass to go back to the Great Lakes. Yet the people of Flint, the heroic and brave people of Flint who knew something was wrong, were told to relax, that everything was in compliance. And in the summer of 2015, a team of scientists led by Mark Edwards from Virginia Tech University, he was a scientist who helped uncover the DC lead and water crisis, came to Flint and worked hand in hand with the residents to conduct citizen sampling of our water. And they were telling us that Flint has a very serious lead in water problem. The water was so corrosive that it was leaching lead from our plumbing and it was going into our drinking water. And there is lead in our plumbing because as a nation, we were stubbornly slow to restrict the use of lead in our plumbing. We didn't ban it from our service lines until 1986, and we didn't restrict it in our fixtures and faucets, in our brass fixtures and faucets until 2014. And to be honest, before all this, I never knew as a pediatrician that there could be the possibility of lead in water, and that's despite caring for hundreds of children with lead poisoning. Water was never on my differential, that long list of possible causes. It was always paint, soil, dust. And I didn't even know that the word lead means plumbing. So PB comes from the Latin plumbum, which means plumbing. And when the Romans built their aqueducts, they actually used lead plumbing. And the strong theories that hypothesize the demise of the Romans is because they used so much lead. And our pipes were so corroded that the folks at the EPA said it was like drinking through a lead-painted straw. And you never knew when a piece of that corroded lead scale was going to come off those pipes and into the drinking water and into the bodies of our children. And I want to share a little bit of lead and water levels. So the EPA, recognizing no safe level of lead, has a maximum contaminant level goal, which is not enforceable, of 0 parts per billion. The American Academy of Pediatrics recommends an action level for schools and childcare facilities at 1 parts per billion, but to date, there are no federal regulations that look at lead and water in schools. The FDA has a 5 part per billion standard for bottled water. The World Health Organization has an action level, which is also not health-based, at 10 parts per billion. The EPA's action level for a water system is set at 15 parts per billion, also not health-based and also not updated for quite some time. And in Flint, we had lead in waters in the hundreds and thousands of parts per billion. And the highest level that I saw was a home that had a lead level in their water of 22,000 parts per billion. And during this time, the summer of 2015, I was a busy pediatrician, a residency director, mom, wife, busy in my own busy bubble, a bit oblivious to what was happening in my city. And I was seeing patients who would ask me, is it okay for me to mix my baby's powdered formula with this water? And I'd be like, of course. Should I be bathing my child in this water? Yeah, why not? Are you sure I should drink more water instead of pop or juice? Yeah, sugar sweetened beverages, drink more water. Because how could our water not be okay? This is America, the richest country in the history of the world. This is the 21st century. It's not 19th century London with raging cholera epidemics. And this is Michigan. Where are my Michiganders in the audience? I know this one. All right, show me your hands. We're the mitten state. So we are literally surrounded by what? Water. We are surrounded by water, the Great Lakes, which is the largest source of fresh water in the world. 20% of the fresh water of the world is around Michigan. But despite all that, there's rules and there's regulations and there's people who wake up every day to make sure that when I turn on my tap, that the water is safe to drink. But that all changed when I heard about the possibility of lead in the water. And I thought about all my Flint kids like Lilly, who are already struggling with every adversity possible, every toxic stress imaginable. And as a pediatrician, I know what lead does. Any pediatrician in public health freaks out when we hear the word lead. We respect the science that has got us to the point of no safe level of lead. And we also know that lead is a form of environmental injustice. It does not fall equally on all our nation's children. Kids in Flint already had higher lead levels, just like kids in Detroit and Chicago and Baltimore and Philadelphia. So I knew that if I was going to make any dent in the story that was already ongoing for a year and a half, that I would need the proof of impact in my pocket. I would need evidence that our children were in harm's way, that it was increasingly in their body. And as we heard earlier, we screen children for lead. We check their blood lead levels as part of routine visits at the age of 1 and 2. And I'm one doctor in one clinic. I can't tell you what's happening with a population. So we tried to get that surveillance data from local and state public health, and we're unsuccessful. And then we went to our electronic medical records. And it turned out that our hospital actually processed most of those lead levels in our community. And in record speed, did that research, that detective work to see what was happening in the lead levels of our children. And contrary to everything that was happening at the national, state, and even city level, where lead levels have been coming down over the last few years, what we saw was that the percentage of children with elevated lead levels increased after the water switched. There was no change outside of our water limits. And in the areas where the water lead levels were the highest, we also saw the greatest increase in children's lead levels. And we also knew that this was an underestimation of exposure because many kids weren't screened during that time, and they weren't screened during the peak exposure of lead and water, which is a younger and more developmentally vulnerable age group. And then I did something that doctors and academics aren't really supposed to do. I walked out of my clinic and I stood up at a press conference before this research had been peer reviewed, which is a total academic no-no. But that takes a long time, and our children didn't have another day to spend. And I stood up with a team of growing supporters, although they kind of look like bodyguards, and shared that our children were in harm's way. And it took a while, but finally, our persistence, our teamwork, and our science spoke truth to power and helped expose this man-made crisis. And good things began to happen. The next day, the city declared a lead emergency. Within a few weeks, we switched back to Great Lakes treated water. The new mayor in December of that year declared a state of emergency for the city, which went up to the federal level. And in January of 2016, Obama approved that federal emergency, which enabled us to become a coordinated response, which also welcomed the CDC as part of our recovery. And our work was finally published in a peer-reviewed journal, the American Journal of Public Health, with some really cool maps with the support of a medical geographer that really allowed us to pinpoint children's blood lead levels where they lived in relationship to the water. The CDC also had access to the larger state surveillance data and published a report in MMWR validating these findings as well. To this date in Flint, we are still on filtered and bottled water as our damaged lead pipes are being replaced. But the city has rolled up its sleeves and we have built a model public health program to buffer the impact of this crisis. And I'm privileged to serve as a director of this Michigan State University and Hurley Children's Hospital Pediatric Public Health Initiative, where we are working in partnership with government, academia, philanthropy, nonprofits in a very community-informed, community-driven, community participatory way. In our initiative, we have two groups. One is a parent partner group where parents are at the table working hand in hand with us. And we also have a youth advisory council, and they just renamed themselves the Flint Kids Justice League, where kids are also telling us what we should be doing. Our work is grounded in science. Flint is a story of science denial. It was science that spoke truth to power, and our recovery is leaning on the incredible science, not only recognizing the science of lead's neurotoxicity, but leaning on the science of child development and toxic stress and early adversity and resilience in our recovery. We are treating this crisis as an added trauma on top of a population already rattled with so many traumas. We talked a lot about lead. We also had an outbreak of Legionnaire's disease. There was lots of skin issues, but really it was also a crisis of a loss of trust, of fear, of anger, of betrayal, of anxiety and guilt. And all those emotions in and of themselves can lead to poor outcomes. But there is hope, and our hope is in our secondary prevention programs, which have been evidence-based, resilience-building, development, promoting interventions that we have been able to put into place since the crisis. And those things include home visiting programs, breastfeeding support, high-quality childcare, Head Start, early Head Start, preschool, early literacy programs, Medicaid expansion, parenting support, nutrition support, mobile grocery stores, mindfulness. And the list goes on and on of the wraparound evidence-based programs that we have put into place to promote the development of our children. So it was about 150 years ago that Frederick Douglass said, "It's easier to build strong children than to repair broken men." And in a city used to building strong cars, we are now all focused on building strong kids. And Flint is learning from our lead disaster and hoping to really turn it into a model of recovery and hoping to be one of America's first lead-free cities. We are replacing our pipes this year. They will be done this year. And when that is done, we will only be the third city in the country that has replaced their lead service lines. We also have Medicaid chip dollars to do actual primary prevention, where people are inspecting homes and fixing up homes, abating homes, irrespective of a child's lead level. For too long, we have been using children and their blood lead levels as the detectors of environmental contamination. And this is where we need to be going in a truly primary prevention manner. We have HUD support dollars and a registry which is putting all this together, which I'll talk about more soon. But our work in Flint is very much beyond pipes. It's beyond people. We are working upstream with many different partners, both in health and outside of health, on the bigger things that all children and families need to be healthy. Things like economic development and living wage jobs and poverty mitigation and restorative and environmental justice and self-determination and participatory democracy. Flint is committed to not being defined by our crisis, but really by our response and our recovery. And the best part of this story has been all the positive ripple effects, especially when it comes to lead. Before the Flint water crisis, we thought we'd taken care of lead. Lead was a problem of yesterday. But Flint reminded the nation that it is a problem of yesterday, and it is a problem of today, and it is a problem of tomorrow. From East Chicago to Newark, people's eyes are opened to the ongoing risk of lead exposure to our nation's children. There's also an increased attention to drinking water safety, environmental justice issues, and children's health. And in a data-driven way, we hope to share all these ripples, to share our positive and proactive work, our best practices with communities everywhere. And we're hoping to do this in one way through our Flint Registry. So this is a CDC-supported project. It's a 4-year grant that allows us to identify those who are exposed to the crisis, most importantly, get them connected to the mitigating resources to promote their health and development and to follow them over time. To date, this registry just launched less than a month ago, and to date, over 6,000 people have started that enrollment process into the registry. And I want to share the logo of this registry. It is the mythical African Sankofa bird. It was suggested by one of our parent partners at one of our community meetings. It is a bird that is flying forward, yet looking back and holding an egg in its mouth. And that is symbolic of all of our work of pushing ahead, but never forgetting the past and always prioritizing the children. And I want to end by bringing us back to Lilly, grounding us in the why that we do all of our work. And Lilly's most important lesson is that the story of Flint is not isolated. The legacy of lead lingers, and without bold investments and policies, we will continue to risk the tomorrows of generations of children. There are ongoing environmental injustices that disproportionately impact the poor and the brown. Deteriorating infrastructure is a public health issue. Flint is a story of what happens when we disrespect science and facts, and we see that ongoing with vaccine-preventable outbreaks, our inaction on climate change. Lax regulations brought us the Flint water crisis. If we learn anything, it's the need to strengthen our regulations, especially when it comes to lead. We need to focus more on prevention rather than being crisis-driven. And then we need to focus more on children because, there's kids all over who are waking up to the same toxicities, Black, brown, white, rural, urban, that are waking up to the same issues of be it ongoing lead exposure or poverty or injustice or austerity or lost democracy. Despite all of this badness, I also want to share that we can learn a lot from Flint. Yes, the story of Flint is a story of a crime committed with absolute indifference against some of the most vulnerable people in our country. But it is also a story about how everyday people, moms and pastors and journalists and activists and scientists and doctors, resisted and said we've had enough and took action and built a model of recovery and hope. And this is the most important lesson from Lilly. It is a prescription of hope that we all stay grounded, awake, and alert to people and problems and places that we choose not to see. That we all continue to ask questions, dig deep, and work together to each be a piece of the answer, not just for kids in Flint, but for kids everywhere. And I'd like to end by sharing a super quick story. So shortly after the crisis, a teacher from one of our toddler classrooms in Flint called me. And she said, the kids in my class made you something and we want to bring it to clinic. I'm like, well, what did these toddlers, 2-year-olds, make me? She's like, they made you a water bottle chandelier. And I'm like, okay, we have a lot of water bottles in Flint. People are dependent on water bottles and filtered water. I'm like, okay, bring it over. I'm like, what could this be? And she brought me this. and it is gorgeous. And I was thinking about these toddlers making this. They were learning colors, following directions, using their fine motor and gross motor skills, making a mess with lead-free paint. But most importantly, they were just being kids. But they turned something that was a tragedy, our dependence on water bottles, into something absolutely beautiful. And this chandelier now hangs in our clinic, and whenever I see it, I smile, and it serves as an ongoing inspiration. But really, it serves as a mandate from our children that we have unfinished work to do. So they made another one recently for our Flint registry. This is that bird that I talked about. And, you know, our Flint kids are unstoppable. They're very industrious. And they made another one for the CDC. So I would like to introduce Dr. Pat Bricey, director of the NCEH and at ATSDR, and I would like to formally present him with this Flint-made, toddler-made water bottle chandelier. Thank you.
Thank you very much. As you're speaking, I couldn't help but think I wish they had a kids' Justice League when I was younger. That would have been really cool. But good afternoon. So I'm going to wrap up today by speaking to you about opportunities for lead elimination and our recommitment to primary prevention. As you've heard, as a result of the sustained community involvement in Flint, the intense media attention and advocacy, support from policymakers, there is increased awareness that lead is still a problem in this country. This offers new opportunities for primary prevention. We need to think boldly, as Dr. Mona mentioned. The removal of lead hazards in the environment, we need to remove them before children are exposed to lead. At this moment in time, there is now the political will to address longstanding infrastructure issues, such as aging pipes and drinking water distribution systems, and to remove lead paint hazards from homes of children with elevated blood lead levels, so that children in those homes are safe and children who might move in the homes in the future are also protected. In light of Flint and to support communities facing drinking water emergencies across the country, Congress passed the Water Infrastructure Improvement for the Nations Act, the WIN Act, in 2016. The WIN Act authorized HHS to take actions to assist the Flint recovery and to improve lead poisoning prevention programs across the country. With this legislation, Congress funded us at CDC to do three things. In the first case, we're asked to enhance our childhood poisoning prevention program activities by expanding lead poisoning prevention surveillance activities. These funds were used to support 14 new state and local health department partners as part of our program. Secondly, we're asked to support the voluntary Flint lead exposure registries you heard about from Dr. Mona through a grant to a consortium led by Michigan State University. Finally, we are asked to establish a new federal advisory committee, the Lead Exposure Prevention Advisory Committee, LEPAC, to advise the Secretary of HHS on issues around lead. In addition, the recently released Federal Action Plan to reduce childhood lead exposure and associated health effects focuses on primary prevention and lead elimination. The report is a blueprint for reducing lead exposure through increased collaboration among federal agencies with a range of stakeholders, including states, tribes, local communities, along with businesses, property owners, and parents. It is a product of the President's Task Force on Environmental Health Risks and Safety to Children. This is the focal point for federal collaboration promoting and protecting children's environmental health. The action plan will help federal agencies such as CDC and others to work strategically and collaboratively to reduce exposure to lead and improve children's health. The action plan outlines 4 goals with the priority actions in order to, first of all, reduce children's exposure to lead sources that pose the greatest risk, again, focusing on primary prevention. Secondly, to identify lead-exposed children in order to intervene to potentially improve their long-term health outcomes. Thirdly, we want to make sure we more effectively communicate about the risks with stakeholders. Communication efforts can never be underutilized. And finally, we need to support and conduct critical research in order to inform efforts to reduce lead exposures and their related health effects. Even though we've known about the adverse health effects of lead poisoning for centuries, to finally address the problem will require commitments and support from many stakeholders, both inside and outside of government. Partnerships between private, public, and nonprofit organizations provide opportunities for collaboration that can do a variety of things, including help guide innovative strategies for primary prevention. They can help raise awareness about the need for lead improvement efforts. They can extend outreach and communication efforts and promote a shared sense of ownership. One such initiative is the Lead Service Line Replacement Collaborative. This is a multi-stakeholder resource launched in January of 2017 to accelerate the voluntary complete removal of lead pipes from the drinking water serving millions of Americans. The collaborative is comprised of 26 national public health, water utility, environmental, labor, consumer, housing, and state and local government organizations. Removing lead service lines provides the opportunity to significantly reduce lead risk of exposure in the drinking water. This is part of the silver lining of the Flint water crisis, this increased attention and renewed commitment to address lead hazards in the environment. While federal efforts related to lead service line removal are ongoing, the collaborative is a mechanism that's focused on this, trying to achieve local action. As you heard Dr. Mona discuss, the Flint Lead-Free Initiative has the goal of Flint becoming a model lead-free city by 2022. Leveraging new and existing resources is key to achieving this milestone in Flint and elsewhere. Besides Flint, the cities of Racine, Wisconsin, and Rochester, New York are also striving to be lead-free communities. Lansing, Michigan, and Madison, Wisconsin have recently achieved complete lead service line replacement. A comprehensive framework for lead elimination that incorporates both community and scientific involvement and broad perspectives will help further the goal of these lead-free city initiatives. Ongoing education among policymakers about the effectiveness of infrastructure improvements to prevent lead exposure can also help sustain this momentum. The Flint water crisis and the renewed attention to existing lead hazards across the country highlighted the need for a variety of things, including the improved risk communication strategies, upgraded environmental health infrastructure, enhanced surveillance, and renewed commitment to primary prevention. In 1967, a scientist, René Dubois, said of a preventable lead poisoning. So this is a quote that goes back to 1967, and it's about lead poisoning. The problem is so well defined, so neatly packaged, with both causes and cures known, that if we don't end this social crime, our society deserves all the disasters that have been forecast for it. Now, I'm sad to say that this statement is as accurate today as it was in 1967. We need to take it to heart. This is a call to action to identify and respond to environmental threats to lead to public health. CDC is committed to help address this threat and to improve health outcomes for our nation's most vulnerable children. Thank you very much. So we'd like to open it up to questions, and we'll start with some online questions.
I want to remind our online audiences you can send questions via Facebook Live or to grandrounds@cdc.gov. From Joseph on Facebook, why is the astounding success in reducing lead levels so poorly recognized?
I'm sorry, can you repeat that? I wasn't quite sure I heard it.
Sure. From Joseph on Facebook, why is the astounding success in reducing lead levels so poorly recognized?
Well, I'm not sure if I would agree with the presumption behind that question. I think it certainly in the public health community is well recognized. And I don't think you can open up a public health textbook, environmental health textbook, without seeing a graph similar to one of the graphs that Dr. Ettinger presented about the decline in blood levels over time. So I think it is recognized, but what's not recognized is that the problem lingers, and that's what's important.
I would just echo that. I think it was and has been touted as a health policy success story. Great policies were enacted that restricted the use of lead in paint and gasoline, and abatement efforts came in, and we saw lead levels go down. And I think it was proven to be so successful that then a lot of the funding, especially from Congress, was taken away because you fixed this problem. So the need and the story that hasn't been shared that needs to be shared more is that the story that it's an ongoing issue.
If you're in the room and you have a microphone on your table, you have to turn that on. If you want to ask a question in the back, there are microphones in the aisle. Yes, ma'am.
Thank you. Jewel Crawford, ATSDR, and my question is, given that lead is a potent vasoconstrictor and also involved in, it's a renal toxicant and also involved in the etiology of gout and hyperuricemia, I'm concerned about the families as much as the children of that have been exposed to lead, because if extrapolated out, of course, undiagnosed hypertension can lead to heart failure, renal failure, and I'm concerned, have there been more strokes, and who's looking at the impact on these children's parents and family members in the adult population?
Absolutely. So the registry is not just for children, it's for children and adults. And we also have a very vocal senior advocate community who's at the table, as well as adult experts who have included all those different things in the registry. Hypertension and gout and early dementia and kidney disease, those are all going to be tracked over time in the registry. And another population that's often neglected is our animals. So our pets in Flint were often the first to show signs and symptoms. Michigan State University has amazing vet school. They came in and also did animal testing after the crisis, also showed increased lead levels in the animals, and provided care for the pets.
Well, are people being encouraged to get their blood pressure checked and to be more proactive about, since it is the so-called silent killer?
Yeah, so not directly, but I think that's something that we can work on to do more reach out with the medical community.
Thank you.
Susan?
Yes, from Net on Facebook. Are the complete lead service line replacements in those few cities, including the private side of the service lines to the homes?
It's both. So in Lansing, Michigan, and Madison, Wisconsin, it was both the public and the private. Lansing was a unique situation in that the city owned both parts of the line, so it made it much easier. And it needs to be a complete line replacements. What we learned from places like Washington, D.C., when you do partial line replacements, you disrupt that lead scale and you can actually increase the risk of lead exposure. So the proper way to do service line replacements are the full service line replacement.
Any other questions? We'll take another one from the online then.
Yes, from Sonia on Facebook. Is there any consistency for data collection across state systems?
CDC's blood lead surveillance system had the first nationally consistent case definition for elevated blood lead levels, and that was in 1995. So while state and local health departments collect data based on local reporting requirements in their jurisdiction, CDC compiles that data at the national level using a nationally consistent case definition.
Yes.
Thanks. That was very nice. And you described the collateral benefits of the whole of Flint approach to the response to the crisis. But I'm wondering if you also identified any collateral risks, in particular, any other risks from environmental contamination other than lead, and is the registry designed to look for some of those other risks as well?
Yeah, so lead was just one thing in the water. So in the beginning of the water crisis, there was a lot of bacteria issues and boil advisories, which is actually one of the worst things to do for lead in water, because when you boil something, it concentrates lead in whatever you're cooking. Then because of all that bacteria, a lot of chlorine was added, and that was kind of an irritant for skin and eyes. And because of the large amount of chlorine that was added, we had a buildup of disinfectant byproducts, total trihalomethanes, which is a long-term carcinogen. So there was many things in this water, some that we know about, some that we don't know about. And the registry is asking kind of broad public health related, disease specific chronic disease things. But the focus really is on what lead can contribute to.
The Flint River, everybody who's seen it, is a waterway that probably has a lot of industrial contamination upstream. So there's likely that there were lots of other things potentially problematic there that unfortunately we don't have any data on.
Back in the day, the Flint River actually caught on fire twice, but it's been a lot cleaner because of the Clean Water Act. But most recently, testing has also shown PFAS upstream of the river.
Thanks for just a wonderful set of presentations. And again, it's just an honor to have you here, Dr. Mona. I was struck with your description of using the electronic health records that the hospital had, and I know that CDC is trying to expand the states that we support screening and testing and staff at. I just wondered, are we looking at electronic health records to broaden the information that we have about lead levels?
Yes, absolutely. In fact, we've just been in conversations with the surveillance group here to look at LabCorp data. And our group has done some work on enhanced passive surveillance to get more real-time data in exactly that fashion.
We're also using our EMR company, which is Epic, to help us build the registry. And they've launched to a population health platform called Healthy Planet, which is helping us do that. After my research came out, one of the attacks was that I was splicing and dicing numbers. So they released a tool called Splicer Dicer, which lets you ask that kind of population level question with your EMR data. But there's more that's needed.
Susan?
From Joseph, can Dr. Mona please speak to any psychosocial health effects she observed in community members as a result of the Flint water crisis? And part 2 of this question, does she think that the resilience intervention she listed might be relevant in other communities struggling with environmental contamination?
Absolutely. So the first part of the question is the psychosocial aspect. And like I mentioned, the biggest crisis of this water crisis was of trust. It was that betrayal, the anger, the fear, the guilt, the anxiety, and just those emotions, as I said earlier, can lead to poor outcomes and lead to, chronic diseases and what have you. So because of that, SAMHSA was involved, the mental health agency, and did a lot of kind of mental health first aid training. We established 24-hour trauma crisis lines and other behavioral health support, all focused on this trauma-informed care. Think of it like a PTSD, and the care that you provide is a different way of providing care. And that's what we've implemented in Flint, not just in healthcare, but also in our education system and other places. Obviously, more to do. And yes, the work that we are doing in Flint, we hope to spread all over, and in a very data-driven way. And the registry is going to help us do that. But this work is absolutely translatable and applicable. The work that we're doing and what we've been able to put in place is not rocket science. It's things that kids need everywhere. Kids everywhere need high-quality childcare and breastfeeding support and nutrition education and expanded WIC and Medicaid and all these things that we know that benefit kids. But we're also hoping to show that this can be used post a crisis to mitigate the impact of what, so we don't see the consequences of the well-known consequences of lead exposure.
Thank you, and thank you for the excellent presentations. Just to build off that a bit, one of the things that is we've seen, and of course is important, and you've highlighted this too, is the importance of having coalitions in addressing public health problems and addressing issues. So in thinking about the sustainability of this going forward, how to maintain that which you have established, what are some of your thoughts on that? And then secondly, on the point of trust, and you mentioned also the anti-vaxxers, because this is also an issue of having the trust of the communities. How is that going forward for you at this time, and what other efforts are being done to ensure that there is that belief and credibility? Thank you.
Sure. So coalition building is tremendously important, and my eyes were really open to this. And before the water crisis, and while practicing as a pediatrician very much in my silo, I kind of felt that pediatricians, we kind of had a monopoly on caring for children. Like there's nobody else that cares more about children than we do. And I was proven wrong time and time again, because so do engineers, and so do journalists, and so do moms, and so do teachers, and so many other folks. So it was all about building a very broad-based and diverse coalition of folks, of unexpected folks that came together to do this work and continue to do this work. The work of lead elimination is also critically multi-sector work, because you have to have housing, and you have to have healthcare, and you have to have education, and you have to have all these other players that may not always be at the same table together. And in places like Flint, I think it's easier because we're a small, big city, and we have a lot of conveners already in place to make that happen. But that coalition building is so important. You saw that picture of me at my press conference. I was surrounded by a growing team of folks who had my back and who had my side and were part of my team. My team was beginning to build. So sometimes, so often we think we're alone in so many of these issues, but really there's other folks out there who we just got to bring them in. In terms of trust, I recently spoke to a conference of philosophers, and the trust issue came up, and a philosopher shot back about the need to rebuild trust, and said, don't you think it's important to always have a healthy dose of mistrust, to always be able to ask questions, and and so that you aren't drinking the Kool-Aid. And I think there's some validity there. I think we should always be questioning, because who would have ever thought that the water coming out of our glasses here in America would not be safe? But trust is also going to be built with restorative justice. Accountability is critically important, and that is still in process. The trials in Flint are to date. There's been about over a dozen criminal charges, including homicide charges because of the Legionnaires' deaths, and massive class action lawsuits. Those are still all in progress, and you can kind of think of it as a truth and reconciliation process. We need to have that accountability and some restorative justice for trust to be rebuilt, but it's a long-term process.
One of the things that I've seen in my travels is that water holds a sacred place in communities. I grew up doing air pollution research, and people can live with dirty air. They can go outside and be teary-eyed because of the air pollution. But you mess with the water and it's a different thing. So there seems to be a social compact with respect to expecting safe water that people hold to the government at all levels. And so that's part of the trust building thing as well. You really have to be very sensitive to the fact that water holds that special place in people's lives. Colleen?
Well, thank you very much, and thank you all of you for really being leaders in this area and bringing a lot of attention. So I'm wondering if the Flint experience is having an impact globally, so not just here in the U.S., but has also led to more of a charge from a global perspective.
I don't know for sure. Our mandate is pretty national, but I think there's a resurgence of concern about lead nationally, internationally, and the role that Flint plays in the international role. I'm not quite sure, but clearly it's a huge driver in the national arena.
Two international perspectives. We have a lot of learners, medical students and public health students, and they often go away abroad to work on a clean water issue somewhere else. And they had a kind of revelation, like, I don't need to go abroad. I can just work on a clean drinking water issue here in the States, in my own backyard. But also the United Nations was also very involved. Before we were a crisis of water quality, we were a crisis of water affordability. During this time, Flint was paying the highest water rates in the country because of this kind of emergency management state. And there was many shutoffs in Flint. People were losing their water, also losing their home because they couldn't pay their water bills, and also happening in Detroit. So the United Nations got involved because of that human right to water, both in Detroit and Flint.
Registry. I believe I heard you say that there are like 6,000 people or so that have signed up so far. Number one, I'm curious as to how long the registry has been open. I'm curious as to if the number or rate of people signing up is sort of what your expectation is, if they're signing up in the areas that were most affected by lead, and if you're doing any kind of evaluation if you aren't getting the people to sign up. So I know that was a lot.
Sure. Yeah. So it's super early. The registry just officially launched like a month ago. It went public. So the 6,000 people are folks that have pre-enrolled, which started about a year ago. And those are just folks that said, I'm interested. Let me know when you've fully launched. So we just fully launched, and we have several dozen folks who've gone through the whole process of the registry, where they've completed lengthy surveys. They've gotten connected to different agencies and supports, be it Medicaid or our primary prevention lead program or early literacy or child care programs, and then we'll follow up with them a year later. The registry is a massive community-informed and engaged process, so we are specifically targeting hard-to-reach populations. Flint's largest, most common second language is sign language. We have a large deaf community, so we're doing specific outreach there, as well to seniors and other folks. So we have a team dedicated to outreach, and it's all being done hand in hand with community members.
Can you give us a sense for what your hope is in terms of the...
Sure. So the maximum denominator of the registry is about 150,000 people. That includes a number of people who lived in Flint, went to school in Flint, worked in Flint, daycare in Flint. And we hope to sign up 150,000 people. We're definitely kind of going after high-risk populations like children. And we're doing it in a very population-based representative way with lots of awesome epidemiologists who are involved. So going after lists from different agencies, but also there's a massive campaign.
One more online.
From Jamie to the Grand Rounds email box. What resources and capacities do communities need to successfully deal with environmental health challenges?
Money.
That could be a whole nother Grand Rounds session by itself. But clearly there's a need to focus on environmental health infrastructure in this country. And there's been a disinvestment in environmental health over the years, and that results in a lot more vulnerabilities for these environmental health issues. So I think that's probably about the best we can say. And if we have time for one more question.
Yes, thank you. And thank you for your presentation. Are you seeing more school failure and behavioral problems in the children? And also, did people have to continue paying water?
So real quick, I can anecdotally, there are stories of more school problems, but the Flint Registry is going to try to answer that question in a population health way. How are the kids doing? Because of the registry, we were also able to lift up something called the Neurodevelopmental Center of Excellence that's working with our schools, where children will have robust neurodevelopmental assessment to help in the school support way. And the other question was about
paying the water bills for the poison water.
So there was a short period that Flint, the water bills were waived, but only the consuming water, not the flushing of your toilet's water. So it wasn't a full waiving of the bills, but that lasted for a short period. People have to pay again, and this shutoffs to this day.
Please join me in thanking the speakers for an excellent presentation. And again, if you're interested, please join us in the CDC library for a book signing.